welcome to another Aging Matters show, a program featuring individuals who talk about aging-related topics of interest to older adults and their families. I'm Cheryl Beversdorf, your host. Over the course of a lifetime, living with Parkinson's disease is unique to each person. As the disease progresses, it's not possible to predict which symptoms will occur, when that happens, or how severe they might be. Regardless of age when diagnosed, however, with proper knowledge and determination, individuals can successfully manage Parkinson's disease. Today, my guests are Melinda Gren and Lisa Rabinowitz with Virginian Home Health Services. Melinda is director and administrator of the organization and also a physical therapist. Lisa is a staff physical therapist. Melinda and Lisa will talk about causes and signs and symptoms of Parkinson's disease, in addition to diagnosis and medical treatments. They will also discuss and demonstrate how older adults with Parkinson's disease can maintain an active and positive lifestyle through exercise and other therapeutic interventions. So thank you, Lisa and Melinda, for joining me today.
Thank you for having us.
Thank you.
Okay. Well, we need to kind of have a baseline here in terms of what Parkinson's disease. So Lisa, let's start with you. Explain to us, what is Parkinson's disease and what causes it?
So Parkinson's disease is a progressive neurological disorder. It relates to a chemical in the brain called dopamine, and when there's a depletion or less of it, then you will often have mobility problems. And when you look at causes, generally they call it idiopathic Parkinson's, meaning there really isn't a cause for it, except there are two conditions that are different than that. One is a genetic component. So if one family member has it, there's a higher incidence of somebody else having it in the family. And then the second reason is environmental conditions. And the most notable is Agent Orange. It was an exfoliant used during the Vietnam War era, and a lot of those service members are now having symptoms of Parkinson's disease.
Well, then, Melinda, what are the early signs and symptoms of Parkinson's disease?
Some of the early signs and symptoms of Parkinson's disease will be things such as small handwriting, a loss of smell, constipation. People might have a masked face where their face just loses expression that it previously had, and it becomes more masked. People can become more stooped over and hunched forward and have difficulty walking or moving. And people also tend to have a lower volume in their voice when they're first becoming symptomatic with Parkinson's disease.
And how does this differ from normal signs of aging? We're always thinking, oh, well, you know, a little ache here and a little pain there. But what you're describing is different. Can you kind of differentiate the difference between
some
the two?
Some of the signs and symptoms that would be early Parkinsonian are things that normal aging would entail, like the being more hunched forward or maybe constipation. But the grouping of the symptoms generally leads to a more likely Parkinson's diagnosis.
And they might, it sounds like it could be more sustained too and continue, whereas some of these other symptoms it's kind of just a bad day. Is that?
That's accurate.
Would you agree?
Yeah.
Okay. Mm-hmm. Well then, Lisa, what we hear most of all about Parkinson's is the movement or the motor symptoms. And I heard about some of these are not necessarily the symptoms that Melinda's talking about, aren't maybe necessarily movement or motor related, but there are some specific symptoms, as I understand it, in Parkinson's.
Yeah, so the classic symptoms with Parkinson's disease that a lot of people get and they go to the doctor for is a tremor on one side. So we call it a resting tremor. So if they put their hand up and they're getting some movement in their hand, they can get them in other parts of the body as well. But it's usually on one side. So that's very classic Parkinson's. The other is walking. People generally go to the doctor because they've noticed or their family member has noticed that they're walking slower, or they're walking with a shuffling gait, you know, real small movement. We get people who have freezing, and that means when they come to a threshold or they're going across a different flooring surface, they have trouble initiating the movement. And we have things called festinations, where they take off, so they start to go really fast and have a hard time stopping. You also see the classic excessive movements. We call those dyskinesias. So those are other ones that are more classic with Parkinson's. And so if somebody has those, then it makes you start to think they might have Parkinson's disease.
And that's always because of this nerve issue and the dopamine that you talked about.
It's
early.
the depletion of the dopamine in the brain. If you don't have enough of it, then you start to get these motor and non-motor symptoms that are symptomatic of Parkinson's disease.
I'm also curious, is there a possibility of balance issues as well sometimes, or not so much?
Huge.
Oh, it is huge.
Yeah. So
Okay.
what we call postural instability, a lot of people, times they're not aligned properly. A lot of times you'll see the forward head. If your head gets out beyond 4 inches from your spine, then you start to lean forward, and that gets you with that fascination where you start taking off. So, and balance is a huge issue with falls. And so these are all things that, you know, physical therapists and doctors are looking at constantly.
Okay. Well, and then Melinda, as I understand it, it's possible that these symptoms will worsen over time. Is that
That's
true?
correct. As Lisa mentioned, it is a progressive neurological condition. So over time, the disease progresses and gets worse, especially worse without any intervention, and certainly worsens as time goes on, even with some intervention.
And can the progression vary with individuals and insofar as the disease? I mean, some symptoms are worse than others. How does that work?
Yeah, we'll see people that have been diagnosed that are the same age, the same time, you know, that they've been diagnosed, and they will have completely different symptomology or completely different stages of the disease. And so you might see someone that has relying on a wheelchair for mobility, or someone who's still fairly mobile and can walk and get around that way, even though they were diagnosed for the same length of time. The disease can progress so differently in every person.
There's so many different variables
So
depending
many.
on the patient and whatever.
Their health status going in, you know, there's all kinds of contributors that can vary with the disease progression.
But then in terms of the diagnosis, Lisa, maybe you can help on there. Are there certain symptoms, now you both have described the symptoms that are present, but if there is to confirm a diagnosis of Parkinson's, are there certain of these symptoms that you two have been describing that must be present in order for the patient to learn, yes, this patient has Parkinson's? Mm-hmm. What are they?
Okay, so if someone suspects that they have it, they generally go to their regular doctor, and usually they're referred on to a neurologist. And there are special mobility specialists who are neurologists, movement disorder specialists.
That specialize in Parkinson's disease?
Mm-hmm.
Oh, okay.
Yes.
Okay.
And so what they do is they have an entire scoring system in order to determine of the symptoms that we were talking about, the motor and non-motor, how many are present. And the classic ones are the tremor, especially on the one side, and the mobility with the walking. So if they have the shuffling, freezing, or festinations, those are more classic symptoms. Or the big one also is what we call bradykinesia. They're moving really slowly. So the doctor will have them get up and actually move, and they will put them through walking on their heels, walking on their toes, because when you change the pattern that people move, you'll see those postural instabilities or balance issues. Now they do some scanning of the brain. It's called a DAT scan, and they can see how much dopamine is in the part of the brain where it should be, and then they can determine if somebody really does have Parkinson's disease or not.
Is there a cure for Parkinson's disease right now,
At
Lisa?
this time, there is no cure for Parkinson's disease. There's a lot of research going on, but there is no cure right now for Parkinson's.
Well, that's one of the reasons why you two are here, to talk about some of the possibilities of living with Parkinson's disease. And so, Melinda, I asked you about a cure, but I also wanted to hear, are there some medical treatments that are used in the interim, or perhaps in concert with some of the therapies that we're going to talk about as well?
Yeah, so we are going to talk about some of the exercise interventions and the therapeutic interventions that are generally prescribed by the neurologist or the movement disorder specialist to decrease the symptomology and to improve mobility for people with Parkinson's disease. But the doctors are also going to work up a medication regimen, and that's going to be very timely and important to stay systematic with the routine of the medications to reduce the wearing off period, or the period of time when the medications start to wean and wear. And then there's also more opportunities for higher interventions that you would discuss with your neurologist, but a deep brain stimulation is an implantable device into the brain that can help reduce tremors and help improve mobility.
All right. Give us a little bit of a hint about what occupational therapists and physical therapists do.
Sure. The PTs and OTs work on a program called LSVT Big, and this is a very intensive therapeutic exercise regimen 4 times a week for 4 weeks, where the therapists are working on amplitude to recalibrate the brain to help movements become bigger and more sustainable, to reduce the risk of falls and that sort of thing. Occupational therapists work in the Big program as well, but they can focus on things such as fine motor tasks, so working on buttons and working on eating, using utensils and different things like that to help the activities of daily life that become impaired with Parkinson's disease.
All right. Well, Melinda and Lisa are now going to demonstrate how physical therapy can help individuals with Parkinson's disease live a better quality of life. Melinda is going to act as the patient in the early stages of the disease, and Lisa is the physical therapist. So let's watch.
I'm Lisa Rabinowitz, a physical therapist with Virginian Home Health Services. For today's demonstration, we are going to only do a modified program. Generally, you would be doing a 60-minute session, and it would be with a certified LSVT Big certified clinician. Melinda, who is my patient, has an early onset of Parkinson's disease, and so she will only need a little bit of help from me in order to get the big amplitude movement. But because clients have various intensities and of the symptoms that they have and progressions, this program can be done holding on with one-handed support. It also can be done in sitting, and it also can be done lying down. Okay, so Melinda, we're going to start your session today. It's the first time that we're doing Big, so I'm going to always demonstrate, and then I'm going to talk you through it step by step, and we're going to do it together.
Perfect.
Okay, how are you feeling today?
Great.
Okay, great. So when we start, we always get into good posture. So can you sit at the edge of your chair? Get your legs nice and wide, nice and tall through your trunk, and let me show you the first one. It's called floor to ceiling. So it's a movement to start, floor, ceiling, out, and we're going to add hand flicks. And to make it so you're working your voice as well, since you have the low volume, we're going to help out the loud folks, and we're going to do a loud count as we do it. Okay. Are you ready to begin?
Yes.
Okay. Floor, ceiling, out. Big hands. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and finish. It's very important when we do the Big program that we have a very clear start and finish. So in this one, this is the start, this is the finish.
Okay.
Your brain then knows that, this is the start of that exercise and the end.
Okay.
You ready?
Yes.
Again. Floor, ceiling, out. 1, 2, 3, 4. Big movement.
5,
6, 7, 8, 9, 10, finish. So after each exercise, I'm going to ask you what effort level did you put into that particular exercise on a 0 to 10 scale, where 0 is no effort, 10 is extreme effort. Not how hard it is, how much effort to be big. How would you rate that exercise?
I would give myself a 4.
Okay, so next time when you do it, I want you to really push out more, go down, make everything even bigger.
Okay.
Okay?
Okay.
And so when you're working at it at home, you want to make sure your effort level is between that 5 and 7 mark.
Okay.
As you get better, we make the program harder. We will add some weights. We'll put you on some of those compliant surfaces that are a little wobbly. And we will do sometimes dual tasking where we'll add a cognitive component to make it harder for you. Okay? So now we're going to move to a standing exercise. Are you ready?
Yes.
We're going to have to move our chairs back a little bit so we have some space. So let me demonstrate. This is the forward step. We're going to do it on one side only. As you get better, we will alternate. Today it's one side only.
Okay.
So it's going to be a big step, come back and finish. So the start is this position, big step, finish.
Okay.
Okay? Are you ready?
Yes.
So you're going to start with your right leg.
Okay.
Big. Can you do bigger with your arms? Okay. Bigger. Good. Bigger. Very good. 1. Count with me. 2. 3. 4. One more. 5. Now we're going to switch to the other side. Are you ready?
Yes.
So you're going to be working with your left leg. You ready? 1. Make it bigger, Melinda. 2. If Melinda has trouble with getting the movement bigger, I'll a lot of times come behind and assist with that. So with the arms, are you ready?
Yes.
Big step on your left, big arm movements, and finish. Ready? 1. 2. Louder. 3. Bigger. 4. Nice. 5. And one more. 6. Beautiful. On an effort scale, 0, no effort, 10, intense effort, how much effort to get the big movement?
5.
Okay, very good. We want to be at least between that 5 and 7 mark. Okay? Now we're going to do the side step. So we're going to have our posture is like this to start, and then we're going to do a big step, and we look that direction, and we finish. Once again, we're only going to go to one side today. Okay, and we'll advance it as it gets easier.
Okay.
Are you ready?
Yes.
Okay, we're going to start with your right foot.
Okay.
And begin. 1, please count. 2, louder. 3, 4, one more. 5. Now we're going to do with your left leg.
Okay.
All right, you ready for the step? Get a nice balance point. Engage your core. Are you ready?
Yes.
Okay. 1, 2, make sure you're looking that way. 3, as big as you can. 4, and one more. 5. On your effort scale of 0, no effort, and 10, the most effort to be big, where does that come?
5.
Okay, very good. The next one we're going to do is the rock and reach. So what I'd like you to do is to put your right foot in front and spread them out. It's got to be bigger than that. And watch me. You're going to come up on your toe, up on your heel, and you're going to rock. Can you start to do that? And then we're going to scissor the arms. And then we're going to count. 1, 2, louder. 3, 4, 5, 6, 7, 8, 9, 10. Now we're going to switch. Separate your feet, make them nice and wide. So it's toe up, heel up. Okay, and start to rock. And then we scissor the arms. 1, 2, 3, 4. Count. 5, 6, 7, 8, 9, 10. On the effort scale of 0 to 10, where do you fall?
6.
Okay, very good. The last one I'd like to show you, and you can have a seat for this. Do you need a little rest? No? Okay, is sit to stand. We're going to start working on not using our hands for that motion. So this is how it looks. The big posture. We push out and we come up like we're going off of a diving board. And then we squat and control it coming down. So it's a pushing out and then a coming down.
Okay.
I'm going to come over while you do that. So if you could push out and bring your hands up. Very good. And then sit down at the edge. Very good. If it was hurting your knee, then we would go with a little higher surface, and then we'd work our way down as you got more quadricep strength.
Okay.
Okay?
No, it feels okay.
Okay, and on a scale of 0 to 10, how did you do with your effort?
4.
Okay. And just remember, it takes a long time to recalibrate and get big again. It didn't happen overnight. It takes time. That's why the program's so long and so intensive. So, you know, just stay really positive about it, and it's going to come. And we'll work as a team.
How long is the exercises going to take me how long when I'm doing them at home?
That's a really good question. So we say 15 to 30 minutes. Generally 30 when you start, because you're learning them and looking at the descriptions. But as you get better, you probably can get through them in 15 or 20 minutes.
Okay.
Okay? Any other concerns?
Nope. I'm ready to go.
All right. Well, thank you.
Thank you.
I hope the demonstration Melinda and Lisa presented was helpful and provided useful information about how individuals with Parkinson's disease can live more productive lives. So I wanted to ask a few more questions just to kind of build on what the two of you just demonstrated. Melinda, what interventions are recommended to help individuals with Parkinson's disease deal with the mental anguish about the disease? You obviously did an excellent job of showing about exercises and this, but my goodness, this must really take a toll on people's mental attitudes. Can you talk a little bit more about that?
Yeah, it is. It can be a very stressful time in people's lives, and not to keep belaboring exercise, but exercise, as we demonstrated, is a piece of it. But there's all sorts of exercise and exercise groups that people can participate in to help deal with the stress of it. There's dancing, and there's boxing, and rock climbing. I mean, there's a multitude of different various exercises that people can do to just help eliminate or reduce some stress. No different than for you or I, if we're stressed, we need to go for a run or, do that kind of thing. But also to deal with the mental anguish, people should really seek out support groups. Support groups for the patient, the person with Parkinson's, but also for the caregivers and the family members. And finding that additional support in those settings can be very helpful for people. And then finally, as the disease kind of progresses and a caregiver becomes heavily involved, we really recommend finding respite care so that the caregiver can be cared for and be able to get out and do the things that they need to do. They need to attend doctor's appointments and things like that to still care for themselves as well.
So Lisa, just give us some sense, how long can a person live with Parkinson's disease, or what is the average?
So basically, Parkinson's disease isn't the reason why, there's an end of life. That's not the reason. It's because of complications potentially on it. But we have clients who've been diagnosed, 20, 30, 40 years, and they're still going strong. So it's not the disease it was of the past. Mm-hmm. The big things you want to watch out for are falls. And that's why you want to see your physical and occupational therapist work on your balance, work on your posture, so you reduce the likelihood of that. If you have swallowing issues, it can cause lung complications. Go see the speech therapist. Work on your swallowing, and on your voice, so that those complications are minimized.
So it sounds like with different kinds of therapeutic interventions and medications and support groups, people can live a long time.
Yes.
With
and
this disease.
Yeah, it's not the disease when I first started out in PT school. I mean, it's with the medications now and with the research and knowing that moderate intensity exercise can help to decrease those progressive symptoms, people are doing very well now.
All right. Well, Melinda, perhaps you could talk a little bit about Virginia Home Health Services. What does your facility do in connection with individuals with Parkinson's disease and their families? And then maybe give us a little bit more information about other resources that folks could look at.
Yeah, I think the biggest thing that why Virginian Home Health Services is unique is that we have certified clinicians that are experts in these programs, the LSVT Big and the LSVT Loud. So these are special certifications that our therapists, both Lisa and I, are certified LSVT clinicians. And so we hold these certifications and we renew them every couple of years. And so it's an ongoing process, but we're the experts when it comes to working with people with Parkinson's disease. And our whole staff sort of embodies that knowledge of Parkinson's disease. And even our nurses, there's not a certification, but they know the importance of medication regimens and, working with people with Parkinson's disease. So it's really important that when you're seeking someone to come into your home or, to work with you, that they know the disease and they know the best ways to work with that disease.
All right. And can you recommend some other resources that are also available?
Absolutely. Lisa mentioned the local chapter of the National Parkinson's Foundation. So ours is the PFNCA, the Parkinson's Foundation of the National Capital Area, and I think the website will be listed. Also, the LSVTglobal.com is the...
And tell us what LSVT, just so we know for sure.
Yeah, LSVT is Lee Silverman Voice Training. That's what the initials stand for, and that was the first client that underwent the protocol and was successful in the LSVT Loud was the first one. And when you go to the website, you'll see the demonstration of Lee Silverman, and it's fantastic before and after with the program. So lsvtglobal.com will take you to kind of understand the programs more. And then definitely virginianhomehealth.org is our website, and you can see our clinicians listed on there and the backgrounds and the expertise.
Okay. Well, I want to thank Melinda Gren and Lisa Rabinowitz for joining me. They are with Virginian Home Health Services, and I want to thank you both for joining me today. And this program is broadcast Sundays at 5:30 p.m. and Wednesdays at 6 p.m. on Comcast Channel 69 or Verizon Channel 38 in Arlington, Virginia. You can also find these programs or this program streaming live at those times on arlingtonmedia.org. Aging Matters is also on the radio. The program is broadcast every Tuesday at 2 p.m. on WERA-LP Arlington 96.7 FM. And you can listen to all the Aging Matters radio programs by visiting mixcloud.com/Aging Matters. Finally, both radio and television Aging Matters programs are posted on our Facebook page, which is facebook.com/Aging Matters WERA. I want to thank you for watching Aging Matters today, and until the next time, remember, age is just a number, not a label. I hope you will join me on the next Aging Matters program.